welcome back to the Therapist Incubator program. You've got myself, Buffy Andrews, and my co-host, Brittany Patterson. We are your resident LCSWs here to help you bridge the gap between your learning in grad school and the real world application of being a therapist. We are going over Module 2 tonight or today, whenever you're watching this. And this module is all about the art of being you in therapy. And we just think that being you and being unique to you in therapy is so important. So we're going to have a little conversation tonight. We've got some really great, journal prompts, quizzes, things like that that you can engage in to help you discover a little bit more of you. But as we go through, feel free to pause the video, take notes, do whatever you need to do, print the slides off if you need to, and we will, just kind of move through together. Thought we would start us off with just a little quote here from good old Emerson. It says, "See yourself in a world that is constantly trying to change you is the greatest accomplishment." And how true is that, right? So being a therapist is a unique privilege that we get to have and hold because we get to hold other people. We get to hold space for others. But in holding space for others, it requires us to know how to hold space for ourselves. And it requires us to have that self-compassion, that self-identity, that strong sense of confidence. And so, it's never good to just mimic other therapists and just do what they do. Because if that's not your skill set or that's not how you jive or flow, it's not going to work. Right. And so, I mean, we could even say, even just between me and Brittany, there are so many differences, right? Of things, like Brittany is so good at sitting with people and doing the sense motor work, and she's really good at silence, and I'm not that person, And so it's funny because we've both had clients that we've actually even shared before too, who will say like different things about each of us and like what they liked about one of us versus what they didn't like about the other or vice versa kind of thing. Just because their needs are different and everyone is a different human being. And so there's always going to be a client that might fit really well with you, and there's going to be clients that don't. And that's okay. I think part of the art of being you in therapy is just recognizing that you're not going to fit with every single client. And that's totally fine. That is 100% fine. So
And one of the most powerful things about that quote too is that that's what we're helping clients do, right? We want them to learn to be themselves in the world, wherever they go, wherever they show up. And so it's really important that we're doing that with them so that they experience and see what it is, what it looks like, what that can feel like for them. So you're really role modeling this sense of being yourself everywhere that you go.
Right. Yes. Yeah. So as we kind of dive into like unleashing our authentic therapeutic style, right? Kind of going along with that is, why is it important to be you? Like, why is it important to be you in the therapy chair? And I personally think that one reason it's so important is because your clients are craving authenticity. They're craving it in a world that is so inauthentic and so social media driven and so, appearance based. Why do you think they need therapy? Why do you think they're seeking out therapy in the first place? Is that they are craving somewhere that they can go that is authentic, right?
Mhm.
And I think in order, like, also why is it so important is just to be fully known, you have to be fully known, right? And so your clients are also craving the ability to be fully known by someone. They want someone to know all the pieces of them, right? I've had so many clients, and it's interesting to have this like kind of theme transpire, but I've had clients who come to this like realization that they just want to be understood. They want to be known, right? And then when people don't understand them or don't know them at all, or like misunderstand or misrepresent their heart in a matter, right? That's when feelings get hurt. That's when emotions get high. That's when relationships kind of, fall apart, right? And so your clients want so desperately to be fully known, but part of the art of being you in therapy is that you have to fully know yourself, right?
Mhm.
You have to fully know yourself as a clinician. And we're going to kind of talk a little bit more about that as we move through this, but just like kind of tuck that away is like, in order to fully know your clients, you have to be willing to fully know yourself, right? Because if you're not even willing to go there with those parts of you, how can you go there with those parts of other people, right?
Mhm.
Um,
Mhm.
so I thought it'd be fun if me and Brittany kind of, I know I might be throwing Brittany on the spot here a little bit, but just to kind of share a little like brief, for each of us moment in time, or, kind of how you got to your own authentic voice as a therapist. And so I'll kind of start in sharing, but basically for me, it's kind of funny because I was actually never someone who went to therapy. I had no clue what it was about, honestly. Like, I got to grad school and was like, oh, okay, like I'm actually in grad school to study clinical therapy. What? Just what? I just didn't realize what I was in for. And as I started shadowing other therapists, it's funny because I shadowed multiple different therapists in my internship. And you could always tell the therapists that were really good versus the ones that weren't. The ones that were really good were the ones who like allowed themselves to be present with the client, allowed themselves to not be so stiff and professional, and allowed themselves to laugh and like meet the clients where they were with different hot topics that were, in the world at the time, or just laugh about things or ask personal questions, right? Or like the therapists who weren't afraid to disclose things. And not to say like, yes, there's a time and a place for not disclosing and making sure that we're not over disclosing things about ourselves, because we're not making it about us. But I think you have to be willing to be honest when a client asks you a question, right? And so as I watched and observed these different therapists, I started to see and realize like, oh, like I don't actually have to be this stiff. I don't have to be so rigid in the way that I'm approaching clients. And honestly, I also realized not every client fits within fidelity, and not every client again fits
Mhm.
within this like mold of a therapeutic process. And when you allow yourself to be present with people, right? That's when your voice starts coming out, right? Because you're starting to notice just like what is drawing, what's pulling on you when you're interacting with a client, what is rubbing you the wrong way when you're with the client, and you're starting to kind of tuck those things away into your memory banks, right? And a part of how I developed my therapeutic voice, I think, actually was when I did intensive in-home services. You get the chance to be in the home with kids, with families. And I remember one family in particular. I'm just going to share this little story because I think it's really funny. And it was like, okay, like I guess I can be me, right? I had this girl who, she was a teenager. She was pretty rough around the edges, sneaking out of the house at night. Like her mom, was the type of mom who had like a like pistol tattoo on her breast and like would flex it. That's what she called it, like flex it. And they were a little like, you know, uh hood, if you will. And so, but it was just really funny because the only way that girl would listen to me is if I got on her level and I was like, all right, girl, like let's talk about this mess, right? Let's talk about what you're getting into. And then I remember her mom vividly one time in this session going, you need to listen to her. Miss Buffy knows what she's talking about, right? And then at the end of my time working with them, now we had so many interesting encounters. I took that family to like Waffle House and we would do so many, different things together just to like build rapport and show them that I'm human and that I'm there to like work with them, not against them and not over them. I was with them, right? And at the end of that time, that mom, she, gave me the biggest hug and she goes, you know what, Buffy, like you're why people change, right? And I think that family just gave me permission to like embrace myself, right? Embrace being me in the therapeutic setting, because we did a lot of good change work, right? Like we did a lot there, but it wasn't until I had that moment that I was like, oh, like it's okay to like not be rigid. It's okay to, not hide behind this professional mask. It's okay to let loose and laugh and cry with your people, because we're human and we just want human interaction and we want authenticity, right? So that was kind of how I came into, I think, understanding and really like harnessing my therapeutic voice. But Brittany, I don't know if you have a quick story of just like something that you noticed when you were able to kind of lean into that yourself as well.
Yeah, I think that my authentic voice, developed over time, and I have a little bit of a different experience in that. I worked in the field before going and getting my master's because I had a undergraduate degree in literature that started out as a dance degree, right? So I thought I was going to be doing something totally different than what I ended up doing.
Mm.
And so I worked in residential treatment with adolescent girls. And if you work closely with teenagers, the idea of not being authentic is just not that's never going to work. Like, and so
Right.
and in the milieu setting too, right? So I wasn't their therapist, I was their staff basically, right? Like I was serving meals and running groups and putting them to bed at night and those kinds of things. And so I got really like tried by fire in a way of, showing up as my full self and being open to being teased and carried on. There was one moment where I was going into a girl's bedroom to get her to do something, and I was wearing these like really high flip flops. Why I was doing that, I
Platform.
don't know. I was in my 20s and stupid, but um but on my way into her room, the flip flop went this way, and I like stumbled into her room, and so then I got named the clumsy one from then on, and it was sort of this thing of like building rapport with them and building relationship as a real person. And
Mm-hmm.
so by the time I went to graduate school and learned how to sit with people in a therapy setting, I just tried to bring that same piece, right? And marry it with some of the clinical theory and the ways of sitting with people. And I'm psychodynamically trained, which is a really interesting play around like, psychodynamics are about being this like blank slate for the client to project everything onto you. But in social work, we kind of make adjustments to that and go, well, no, you're a real person in the room with this real other person, right? And like finding ways to do that. And then finally, one of the ways that I, developed an authentic voice was really by developing as a person. And then, I was really, I was in the supervisory role, or supervision rather, with my supervisor second year internship. And she was saying, you really take to this. Like this comes very easy to you. And
Mm-hmm.
I thought to myself, well, yeah, I should probably know how this works by now since I've been in therapy myself off and on since the age of 14. Right. So I always say I became a good therapist by being a good client.
Mm-hmm.
And so you learn to kind of show up fully and completely yourself. And then just as the therapist, I kind of edit out any of the self disclosure, right? I don't share a lot about myself with clients, but they get fully me,
Right.
right? I show up as my full self. And
Yeah.
that took time to develop and
Right.
kind of get comfortable in your own skin.
Yes. Yeah, yeah, yeah. Yeah. So, okay, thank you for sharing that. I think it's always good for people, especially new therapists in the field, to hear our stories and to understand even like where we come from with some of this. Again, that's part of being authentic and being real. So another part of, the art of being you in therapy and being able to unleash your authentic therapeutic style is really knowing who you work best with, right? Because here's the deal. Like at the end of the day, if you're getting clients that are creating this like friction in you, or clients that are creating some sort of inner dialogue that is not helpful or beneficial to you in any sort of way, you're not going to come across the most authentic, more than likely, right? You're not really going to be yourself because there's something causing you to hide or something causing you to, again, just not express maybe as fully as you could, right? So part of that, that we think is really important is, at the end of your day or week, right, to just be able to take an inventory of your week of your clients, right? Ask yourself, which client sessions did you enjoy the most? Which client sessions did you feel like you showed up as your whole self? Which client sessions made you the most nervous? Which client sessions made you feel the most at unease, right? Dis-ease, right? It's very hard to be nervous and authentic at the same time, right? It's very difficult to do that. But when you know who you work best with, that's when you can kind of start to niche down. And we'll talk about niches and that kind of stuff later on in other modules. But knowing just who you work best with and who you can show up as your full self with, that makes a world of difference in your ability to be you in therapy, right? And then next we have this quiz that Brittany found, and we'll add this again in the little PDF that we will do or sorry, attached to this module. But it's a quiz that basically walks you through the different kind of like therapeutic styles. Brittany, do you want to kind of explain how I might?
Yeah, and
Yeah.
if you might even be able to click that link so they can actually see it in real time or no? Okay,
No, I can't click it on there because it's not like a hyperlink, but
gotcha.
I'll attach it as a link for
Okay.
them. So yeah.
So what this is, this is it's tied to a research study, but you don't have to do that. It's just the tool that they used, right? And it gives you like this set of questions about your practice, about how you think about clients, about how you think about the work. And then it rates at the bottom, it'll give you like scores of what percentage of whatever theoretical model you kind of lean toward, right? So it's kind of puts in like psychodynamic, percentage for that, behavioral, cognitive behavioral, and a percentage that. And so it's a really nice tool to kind of, as you're starting out, to kind of take a little inventory for yourself of like what kinds of therapeutic theory have you kind of integrated into the way that you think, right? Because we all go to different schools of counseling, different, depending on what university you went to and what program and what they focused on, you might have gotten a varying kind of, set of skills, set of theoretical frameworks. But as you get into the field, you sort of learn by doing, right? You learn that, oh, I really think this way, or I tend more toward this other way. And so this is a really nice kind of thing to do to sort of see what the study kind of pops out, right? What score you have. And then to kind of think about, okay, does that fit with the kinds of clients that I'm seeing?
Mm-hmm.
Right? And am I hearing from clients or noticing from clients that they're comfortable with that particular theory?
Mm-hmm.
Right?
Mm-hmm.
Because these can shift and change over time, right? And where what fits best with your authentic self is where you should try to kind of
Mm-hmm.
gravitate toward,
Yeah.
right?
Yeah.
But this is a nice way to start with it, and this is something that when I was in management, and I was hiring people, I would ask as part of the hiring process, what theoretical framework does it form your work, right?
Mm-hmm.
And if you're new to the field, that you might get stumped by that question, right? But it's important to think about all of the things that you learned in graduate school. Were there ones that excited you more than others?
Mm-hmm.
Were
Yeah.
there ones that made more sense to you than others? That kind of spoke to you in a certain way or made you think about your own life in a certain way, right? And those might be ones that you might want to kind of gravitate toward and learn more about or really adopt as part of your framework. It doesn't mean you can't do other things, but that's sort of your frame, right? That's the therapeutic lens that you look through. And so this is a nice tool to kind of see where you're at and then kind of keep handy for future years as it grows and changes over time.
Right. Yeah. And when you know kind of which framework, fits with you, kind of like we talked about in the first module, that might help inform even what trainings you choose to go into, because maybe you want to learn more of that voice, right? With psychodynamic work, maybe you're like, oh, like that speaks to me, but I don't have all the language yet. And so sometimes finding you in therapy and unleashing your therapeutic style comes with learning the language also, right?
Mhm.
Because even as you learn language and as you do a lot of these different trainings, you're going to start to have these little light bulb moments and you'll be like, oh, wow, I want to do that. And oh, wow, that makes so much sense to me. Like, let me put that in my pocket. Right. And so then it all just becomes tools in your toolbox. So, yeah. So we'll attach that quiz for you guys to take. That way you can just have a framework and a frame of reference. And hey, if somebody's interviewing you for a job, now you know how to answer that question. Right. So moving on with unleashing your authentic therapeutic style, something that we thought was important to hit on is just the fact that being authentic is not the same as being unapologetic. Brittany, you want to hit on that?
Sure. So there's this phrase that we hear a lot in our society today about being unapologetically whatever, right? Unapologetically liberal, unapologetically something, right? And what it's become to mean is kind of this, in your face, like, I don't have to worry about what anybody thinks about me. I'm just going to share whatever comes to mind. I'm going to be myself, right? But when we're thinking about how we show up for clients, we really want to kind of steer away from that kind of an attitude, right? And be authentic, but be thoughtful at the same time,
Mm-hmm.
right? We want to be yourself, but it's sort of this balance or this dance we do, right? As you're being yourself in session, your primary goal, your primary focus has to be the client, right? Everything that we do in session, everything that we do in this work is in the service to the client. So if there's something about you that is truly authentic but might not serve your client, then that's something that you have to be thoughtful about how you show, right? So just to be really, really transparent, right? I am a person who in my personal life, in my world, right? I am a very strong faith-based person, but I also am a person who is okay with certain swear words. Right? I'm not like super conservative, right? Like when I'm talking, you might hear the F word in certain contexts. You might hear things that like kind of go, oh, okay. But when I'm with clients, I don't show up that way with every single one of them, right? Some of them, they might say something and I repeat it and I'm perfectly comfortable repeating it the way they said it, right? With all of the explicatives in it. There are some other people that I have figured out in meeting with them and doing the assessment and everything, that's something that if I show up that way, it's going to be really off-putting and it's going to like distract from the work, right?
Mm-hmm.
And so I don't show up. And that doesn't mean that I'm not being myself, right? It just means that I don't have to say everything that comes out of my mouth, out of in my head, like in that candid kind of, unapologetic.
Yes.
And
Yeah.
so this is something to think about and be thoughtful about how you're showing up, not kind of putting on a weird therapy voice and like becoming a different person in a way, but just being thoughtful about which parts of yourself you really let loose and when and why.
Yes. Yeah. No, that's very good. I can't tell you how many clients I have met with who have said things like, I felt like I was their therapist, or things like that, because yeah, you do have to be just aware of, yes, my authentic self, but how, like you said, how is it serving the client? Is it that it's building rapport? Is it that it's, allowing some common ground that maybe you guys didn't really have before? Is it that it's building trust because you've shared it? Is it that it's reassuring the client that you do have some sort of experience or knowledge about a certain topic, right? Because sometimes I'm one that I might give an example from my own life. I'm not going to give like details of names and places or whatever, but I'll say like, yeah, I've had a situation like that happen where this and this unfolded. And, I'm wondering how that might, look for you if you were to adopt certain, skills that I used? Or what would that look like if you, had the same support system that I had, right? How do we help you get that? Whatever the situation may be, right? So there's definitely like, you have to just kind of think through, what purpose is it serving for me to share some of those things? And again, you can still be you and not give every single detail of your life to people in the therapy chair. Um, okay, moving forward, the last one that we have about unleashing your authentic therapeutic style is really just about developing that clinical repose. So this is really about holding the environment for the work and the relationship, right? Like your ability as a clinician to hold the both and, right? To recognize there's work to be done and there's a relationship here. We're not like, just venting to our besties here. We're not here to gossip or spread, rumors about whatever. We're here to do work. We're here to work with our clients. So it's that holding that both end of like, I have this really nice relationship with you, but also there's some work that we're going to do here, right? It also tends to, when you can develop this, it tends to relax and reassure and open others to the process, because it gives clients confidence in your reliability, right? So the way that's expressed is a relaxed, kind of open posture, an open gaze, calm, confident manner in how you're working with the client, right? We don't want to have this like rigid, tough, like I'm behind my computer, all the time kind of demeanor. That's not very open. But it's also not very professional or like clinical to like come in your sweatpants and like, your hair is all floppy to the side and you're like, oh yeah, girl, wild night last night. Can get myself together this morning. Like, no, that is not what we do, right? So having that clinical repose is just about your ability to hold the both and, really, both being professional and being personal, right?
Mhm.
Um, and Brittany, do you want to maybe walk them through the journal prompt? Do you have that?
Yeah.
Okay.
And I just wanted to add before we get into that piece about confidence in manner with regards to the processing, right? So it comes back to that point we talked about earlier around, you can't be nervous and authentic at the same time, right? And so this is really about, growing and developing your ability to sit with the process and be confident in it,
Mhm.
and to trust that you know how to sit with people, right? You don't have to have all of the answers, but you do need to be able to sit confidently and exude a sense of, hey, we're going to deal with whatever you bring in and we're going to work it out together, right? And so you're bringing your whole self as in service to that, but that confidence, that ease with it, that, not rattled by anything kind of feel is a huge part of the work. Like if you can get that down,
Yep.
the models, you can pick those up later, right? Like, you don't have to know the ins and outs of CBT to do good work with people. You just have to cultivate curiosity and be confident in your ability to hold what they're bringing.
Right. Yep. 100%.
So, in the interest of that, we're just gonna I'm gonna take you through this exercise. So if you have a minute, if you want to do this in real time as you're watching this, is like, pause the video and go get a piece of paper or your favorite journal or whatever, and kind of, come back and sit quietly with yourself. And what we're going to do is you're going to kind of write in a journal what kind of comes up for you in this process. But we're going to you can close your eyes, you can just sit quietly with this, and we're going to kind of think together and reflect together on what this idea of clinical repose is. So the first thing is in your journal to describe your view of your own clinical repose. Imagine what it would be like to be your client, to see yourself through their eyes, and reflect on any ways in which your clinical presence is different from your manner when you are just being yourself in your personal life. Note any things that disrupt your clinical repose, or particular clients or conditions that challenge you. And as you kind of notice those things coming up, ask yourself, how will you work to enhance your repose and presence with those challenging situations? As you think about repose and clinical presence, what do you learn about yourself? Is your clinical presence beginning to alter the way you carry yourself in your private life? And have others in your life commented on that? Have they noticed that since becoming a therapist, you show up differently in other areas of your life as well? And so just take a few minutes to kind of reflect on that. The first time that you do this journal exercise, certain things might come up. I encourage you to return to this throughout your career, to return to this in a week or two, right? To really come back and keep and cultivate a sense of reflection on these things. Just as a personal kind of aside, when I was pulling together this module and adding this clinical repose kind of journal entry mindfulness practice, when I listened to those questions, I started to think like, oh wow, like there are I haven't thought about this in a really long time, right? And I pulled it from a textbook from my days in graduate school, right? All that time ago. And so it was really enlightening to go, oh, like, yeah, my, clinical self has informed the way that I show up in my personal
Mhm.
life, right? Like, or how I think about the world has been impacted by my clinical work.
Mhm.
Um, and to think about the kinds of clients that challenge that make it hard to keep that clinical, right? And that will change over time, right? Who you think is most challenging to you now, I guarantee you will not be the same type of client that's challenging to you in 20 years, right? So this is a good like practice to just hold and keep in your back pocket and keep cultivating that reflective piece.
I love it. Yeah, that's a great journal prompt, and we will add that into, again, the little PDF that we will print for, or not print, but put available to you guys online for each of these modules. So just to kind of keep moving through in the essence of time, because we're trying to keep each of these to an hour module. So part of, again, being or not being vulnerable, it's on the slide. Part of being you in therapy is embracing vulnerability, right? Part of being you in the therapy room, therapy chair, therapy center, wherever you're at, is about embracing vulnerability. Part of embracing vulnerability, number one, I think, is avoiding hiding behind the mask of professionalism, right? It's so easy to do. I think one of the number one ways that I see that come out, and I might have just seen this more often because I was in a high crisis, kind of job and role before I started doing private practice, is in the area of suicidality. And this is a hot button kind of topic, but I feel like a lot of people avoid conversations of suicidality or suicidal ideation, suicidal thoughts, because of this like professional liability that gets lumped into it. And so people tend to hide behind the mask of professionalism in that way and forget that there's a person sitting there across from them that is just begging to be seen, that
Mhm.
is just begging to be known, right? And is entrusting you with some of their deepest, darkest thoughts and feelings. And obviously we can do a whole like training on like suicidal thoughts, suicidal behaviors, suicidal intention, versus action, whatever. That's not what this is about. This is just my 2 cents, I guess, on what I've noticed is that when it comes to those kind of like more intense issues, sometimes we start to push people away because it's too difficult or it causes too much liability or we weren't taught how to like navigate that in grad school, so therefore it feels vulnerable, like it feels vulnerable to sit with someone in something really dark, because we don't know how, and we tend to then hide behind that mask of professionalism, and we discharge our client off to someone else who's better suited for them, or we you know want to put them up the ladder to the next level of care. But the reality is, like, part of being you in therapy is, like, being able and willing to be vulnerable enough sometimes to sit with those people, create safety plans, create the supports, create what they need, but, like, seeing them and being willing to sit with them in that. And I think that that's really, really important. And there's other masks of professionalism too, where we like hide behind our office policies or we hide behind our, like no show fees and like whatever, that kind of comes out as. Um, but the reality is people are people, right? Like that's still a thing. And so we still have to know how to navigate people and talk them off a ledge sometimes, right? And sometimes you cannot talk somebody off a ledge if you're just hiding behind a professional badge, right? Anything you want to add to that really quickly, Brittany?
Yeah, and I think, what we're talking about in various ways with each of these slides as we go through is this balance and this integration, right? It's integrating showing up as your real, authentic self and the professionalism and the theoretical framework and the training that you received, right? We're not suggesting that you throw that out. It's just you don't always have to lead with it, right? You don't always have to, you can deliver the same information about the office policies or the cancellation policy through the lens of your authentic self, as opposed to the nuts and bolts and kind of
Right.
come at them like you're reading something off of a script. And
Yeah.
so that's the piece around like learning that dance, learning to kind of really remember who you're talking to and put yourself in their shoes. And what if what you're saying, would it land with you if you
Right.
were the one listening to
Right.
it,
Mhm.
right? Or would it kind of feel, clinicized or sterile to
Right. Yeah. So with that like sterile, mindset, I think part of embracing vulnerability again is being a real person in the room, being willing to again when a client asks you a question, again, you don't have to give every detail of your life, but you're a real person,
you?
right? Like when someone says, "How was your weekend?" You can say, "Yeah, me and my husband had a great weekend." That's fine. Like, no, they're not gonna go like know every single thing about your life because you said that, right? But there are definitely some people who are like, "Oh, they asked about my weekend, like I shouldn't share anything about that." Right? And it's like, no, you can still share without being detailed about everything, right? I mean, these are skills that we teach our clients, right? Like interpersonal relationship skills. How often do we have those clients that come in that are, boundaryless with friends or family, right? And it's because they're maybe like an oversharer. Okay. We're teaching them how to not be an oversharer, but still be true, right? Still be true to who they are. And part of that is embracing vulnerability, um, and being able to.
And really quick, I want to interject around this is that this came up a lot when I was doing home visiting models, right? When you walk into someone's home and they offer you something to drink, right?
Mm,
Some of my colleagues would always say no because they thought that the professional thing to do was not to receive. But that didn't build rapport, right? And some clients started to kind of take offense to that, of going, oh, okay, well, this, you're in my home, I like to serve you, like, why didn't you ever do that? And so when you're in a private practice setting, obviously that's different, but I think that the same thing applies. It's okay to, say hello to your client in the lobby and say, I'll be right with you, I just have to use the bathroom real quick, right? It's simple, it's weird, but it's this little tiny thing that reminds them that you are human too,
Mhm.
right? That you have to pee in between sessions, that you need to fill your water bottle, that you are really about to lose your mind and you need that extra cup of coffee. It is okay to say those things,
Right.
right? And let them know, because that it helps you be more relatable and real to them. And
Mm,
that's not like a huge self-disclosure, right? That's just normal, like
yeah.
hydration and urination. Like it's something all human beings
Yeah.
do.
Yeah. Yeah. So being real is like part of, embracing that vulnerability. And then I think the last two bullet points we have on here kind of go hand in hand, but being alert to your empathetic failures and then taking ownership of your mistakes, right? So empathetic failures, what does that mean? It means when someone shares something with you and you maybe don't empathize in a way that's truly fruitful for that conversation, right? We have to be willing to kind of like take note of that. Sometimes your clients will let you know when you did a bad job
Mhm,
at that. Sometimes
mhm,
they'll be like, whoa, that isn't what or they're misunderstanding you, or something along those lines. And I've had clients straight up say, like, I don't think I'm understanding what you're getting at, right? Or something in that regard. And so then you have to kind of take ownership, like, hey, that's not what I meant. Here's where I was going with that. I think I did it in a poor way. Let me
mhm,
try again, right? Um, and so being aware of that is being vulnerable. And sometimes your ability to, even if your client doesn't call you out on it, but your ability to go back later and say, hey, you know what? Last session when you were here, you shared some really hard stuff with me. And I don't think I did a very good job holding space for you that day. I'm really sorry,
mhm,
right? That is huge for a client to know that you're paying attention enough to recognize that you made a mistake, right? And to take ownership of that. I always talk to my parents that I work with about how making repairs with their kids is almost more important than just not making the mistake at all, right? So the ability to go back to the kid later and say, hey,
mhm,
I responded really poorly to you when you were trying to get my attention. I'm really sorry. I was just very stressed in that moment and I didn't know how to handle it very well. Will you forgive me? Like, I'm really sorry, right? That matters more. And that's going to stick with that kid more than you're just not making the mistake in the first place, right? Your ability to take ownership of what you did wrong is huge. And so that's the same in the therapy chair, right? Is your ability to just recognize where you fall short, and be willing to step up and say, hey, I'm really sorry. I didn't mean to ignore you in that way or to dismiss what you said or, what have you. So anything quick you want to add to that, Britt?
Yeah, just staying alert to misattunements,
Mm-hmm.
right? When you feel like it's off, or you've been talking for too long and you can see that they're kind of glazing over it, right? Like whatever it is, you kind of staying alert to those things, noticing when those things are happening and being comfortable, like Buffy said, with naming it and
Mm-hmm.
comfortable with exploring it and asking the client, how was that for you? I recognize that maybe I didn't really attune to you, or I wasn't really, we weren't on the same page in
Mm-hmm.
that moment, right? And that's kind of that vulnerability piece is huge, of being willing to own up to that and apologize and work it through with them is also a huge part of the work, right? That's the corrective emotional experience that is embedded in therapy. They're not, we want them to have an experience like that where they may not have that in their personal relationships
Right.
outside the session.
Right. Yeah. No, that's great. Um, so the last little bit with the ability for you to develop that art of being you in therapy is really about fostering personal growth within your professional practice, right? So your ability to foster that personal growth in your professional practice is huge. So we've got 4 ways here that we think are really important for being able to do that. Way number 1 is being a client yourself. Like I mentioned earlier, I had never done therapy before I became a therapist. And then I was like, maybe I should go to therapy. Like, so then I started going to therapy, and it was actually really like the reason we put it on here is because it is really beneficial to see how do people attune with you. How do people who are not your close friends or not your, like mentors or what have you, how do they attune to you? How do they ask questions? And sometimes you just like glean that ability to like, again, gain question asking abilities by hearing the questions other people ask, right? If you've never been asked really good questions, how do you expect yourself to ask really good questions? You can't just read a list of questions in a book and think that that's going to be enough. You have to like hear the way people ask questions and notice what sits well and what doesn't sit well with you, right?
Right.
Way number 2 is practicing self-empathy. So your ability to notice, care about, and respond to your own felt needs, right? I was actually talking with a client today about how our nervous systems heal when they can trust us, right? I was reading something about someone saying anxiety, you don't heal anxiety by just doing your breathing techniques and your whatever. You heal by developing trust within whatever that realm of anxiousness is coming from, right? And it's the same for our nervous systems, right? Like when we drink water when we're thirsty, when we go to
Mhm.
the bathroom when we need to pee, when we, move our bodies when we're feeling a little antsy, when we take a deep breath, when we sigh fully, right? That's our nervous system trusting that we are attuned to what our bodies need. And so we're listening and we're meeting those needs. And when you practice self empathy, you're developing that ability to just notice what you need. Like, ooh, things are coming up for me that are making me feel anxious, or things are making me, feel out of control or overwhelmed or what have you. If you can't notice that stuff within yourself, how do you expect to be able to notice that fully in other people? Right? Having that ability to really like be hyper aware of those micro needs too, and like emotions under the emotions, we talk about that a lot, but that ability to pay attention to that is huge, right? So practicing that self empathy.
And
Um,
I think that's a really big one for therapists, right? Because we spend so much time, and especially when you're new to the field, right? Because you're figuring out what this thing is, right? What this hour-long conversation with this person is and what's supposed to be happening there. And so the focus is so much on the client. The focus is so much on attuning to them, noticing any shifts in them, giving them the nuggets of wisdom that you've been trained to give them, and making sure you help them leave the hour with something to go into the week with, whether that's homework or just some new insight. The focus is there, right? It's this output, and it's so important to use those same skills to then input,
mhm.
right? And almost treat yourself as your own client sometimes, and pay attention to what's going on inside of you and attune to it. And and that's part of going to therapy yourself, right? Is like allowing someone else to attune to you, allowing that process to happen, and what it get comfortable with the experience of being a client. But
Mhm.
so often I find that we're really good at doing this for clients, but then when you really look at your own life, it's like, yeah, I can't remember the last time I ate, right? Like, or that we have to kind of really think about that, and make sure that you're taking just as well care of yourself as you care for the people that you work.
Yeah. Yeah, exactly. And so that kind of goes into number 3 of like practicing good self-care and healthcare. And I put those as 2 separate things because I think we have this like mindset as a society of like self-care is journaling and taking your bubble bath and getting your nails done all the time and, you know, getting your hair did. And like, yes, those things are good because those things can make you feel good, but it's self-care mixed with healthcare. Healthcare is those foundations of health. Again, yes, like when did you eat last? How much water have you drank today? When was the last time you moved your body, right?
Mhm.
Because again, so much of mental health is the ability to take care of yourself. And again, your nervous system screams at you and yells at you when you haven't taken care of your body, right?
Mhm.
So that's, I mean, and that's sending signals up to your brain that's causing anxiety or causing depression or what have you. And so if you're not taking good care of yourself in a healthy way, it's going to make for a very difficult authentic voice showing up for you in the therapy chair, right? Like, think about just for a second a day where you haven't drinking very much water, you haven't moved your body in maybe like a couple weeks, you haven't had enough protein for the day, maybe you forgot to shower, right? Like, whatever that looks like for you, you show up. How do you feel mentally, right? Like, when you show up in that space, what are you coming in with? You're probably coming in with a little bit of some brain fog. You're probably coming in with a little bit of just like self-doubt or self-deprecating thoughts or shame or, you know, whatever that might be that's showing up for you. If you're showing up in that stance, is that your true self? Right? Like, is that your authentic self? Is that really who you are? No. You're not the cranky pants that didn't eat, right? Like, you're not the like anxious Annie. You are normally very well put together and you're normally very organized, but you had a week of craziness going on, right? So that's why it's so important to take good care of yourself because if you don't, you can't show up in an authentic way in your therapy chair, right? So it's just so important to remember that.
And I think, I think it's important to note that we recognize that people come to this work for a variety of reasons. And one of those reasons might be similar to mine, right? That you learn to be a therapist by being a good client, right? And just to be clear, I wasn't going to therapy at age 14 because I wanted to find myself, right? Like I was going because there were major issues, right? And so we all carry, if you have your own trauma, if you have a history of eating disorders or self-harming behaviors or, major depressive disorder or things like that, that brought you to this work. Maybe because you had a great therapist and you were like, I've, felt so much better and this person really supported me. I want to do that for someone else. Right. It's also important to remember that it even if you've gone through all of the treatment models and feel like whatever issue you were dealing with has been resolved, right? There's a maintenance to that. And to
Mhm.
remember that we owe it to our clients to take care of those things in us.
Right. Mhm.
And that and to think of that in a full holistic sort of way, right?
Right.
That you might have resolved the trauma, but you still have to keep training your nervous system
Mhm.
to keep that healthier healed version of it rather than reverting back to the hyper species
Right.
species.
Yeah. 100%. No, that's very good. And so, and then the last, like, I think fostering personal growth way is number 4 is being prepared to implement new techniques, strategies, and make pivots when necessary, right? So part of that personal growth as a therapist, and again, staying authentic to yourself, having that authentic voice, the art of being you in therapy is being willing to try out new things, right? Like try out the new, EMDR model that you learned, right? Try out some somatic sensory processing stuff that you learned, and be again vulnerable with your clients in that process to say, hey, like I was just trained in this, but would
Mhm.
you be willing to let me try it with you? Right? You might find that you really, really like it. you might start doing something and you're like, wow, that was really fun. Or wow, my client showed so much growth and so much progress. How amazing. And so as you learn these new skills, new tools, be prepared to implement them. Don't just like learn them and let them fall by the wayside, but part of implementing them is being vulnerable enough to say, hey, I'm new at this. Will you let me be new at this with you? You know,
Mhm.
and your clients will be receptive, believe it or not. Like they're receptive, and you don't always have to have 10 years of experience under your belt in order to do something, right? That's completely okay. And I think part of the personal growth and the way you continue to be you in therapy is just when you continue to make those pivots as necessary. Um, so that is us in a nutshell for being able to, let me stop sharing my screen really quick, for being able to help you kind of figure out how to be you in therapy. And like I said, we will have the PDF of the journal prompt and that quiz that you can take. We might throw a few other things in there too. Um, but that is the way to develop yourself in being you in the therapy chair. The next module that we're going to go through is all about mastering the clinical landscape. So in that module, we're going to talk clinical language, note writing, techniques for note writing, getting paperwork done, clinical connections, so professionals you might need to know in the field, and some evidence-based practices to explore. So make sure you tune back in for that module, and we will see you guys in module 3. Thank you.
Thank you.